everyone out there. Thanks for joining me this evening. My name is Dr. Shayla Toombs-Withers. I am the physician owner of the Essence of Health Wellness Clinic. Essence of Health Wellness Clinic is a direct primary care family medicine clinic located right here in downtown Chattanooga. Essence of Health Wellness Clinic was opened in June of this year, and so we are about 5 months into this clinic. So I'm here today to share with you more about what exactly direct primary care is and how direct primary care may be a great benefit for you and your family. So, direct primary care is a model of care that was started in the early 2000s. So it hasn't been around very long in comparison to traditional healthcare, but it has been around a little while. A lot of people compare it to concierge medicine, but I'll discuss more shortly about how the two actually differ and how direct primary care may be actually a bit more affordable for you. So we are at a point of healthcare in this country where things tend to fall into certain groups. We have our set of people who are uninsured, who have no insurance at all. We have our people who have some state-assisted insurance, and that includes like the Medicaid program. We have some people who fall into having insurance, but their rates of their insurance, particularly their deductible, is so high until they really don't get any benefit from their insurance because they can't really afford to use it, even though they may have insurance. And then we have people who have what we consider good insurance. That's those people who may not have a ridiculous deductible payment to meet every year, but even those people can still have some issues with accessibility, even with having insurance. And then we have people who have Medicare, our aging population who qualify for Medicare. And so they have government assisted insurance, but as we know, it's a little bit different from the Medicaid insurance, and so they tend to have a few more benefits with Medicare. However, direct primary care can actually be beneficial to all of those groups of people, and I'll explain to you why. So, in the traditional healthcare model, when you see your family physician, you may call. There are some places now where you can actually make an appointment online. However, sometimes it's very difficult to get in the same day for that appointment, and you may have to wait a week or two. And if you are new to that office, you may even have to wait several months. I have heard people quote me that it may take anywhere from 2 weeks to a few months to get into a office to see a primary care physician as a new patient. So you make that appointment. Then when you go into the office, you're usually greeted by a receptionist. And then that receptionist usually takes your ID, takes your insurance, runs all of those things through, make sure all of that checks out. You may wait in the waiting room for a while. That's variable based upon the type of office you go to. And then you're usually taken back to the back of the office by a medical assistant or a nurse. They take your vital signs and they get you ready for the doctor. You may then sit and wait a little bit longer in the room, waiting for that doctor to actually arrive and see you. And that time frame is also variable based upon where you're at, where that doctor is at, how busy that doctor may be. Following that, that doctor may have about 10 to 15 minutes with you. That's usually the average that the doctors get for a traditional office visit in a traditional practice. And then you may get a prescription sent to whatever pharmacy of your choice for you to go pick up, and then have the pharmacy check your insurance and tell you the cost of that. And then after you leave, a few months down the road, then you'll see what your bill was, and then you'll get to find out how much that office visit actually cost you. So direct primary care is a lot different from that. So when you walk into a direct primary care office, particularly when you walk into the office here at Essence of Health Wellness Clinic, you're greeted by me, your family physician. There is no receptionist to check your insurance or check your billing. There's no long wait in the waiting room. There is a waiting room, but that doesn't necessarily mean that you're going to have to sit in it or wait in it. You're greeted to a coffee bar where you can fix yourself a cup of coffee or a warm cup of tea or have a bottle of water. And then you're brought back into my office here for us to chat and discuss why you're here and for me to learn more about you. There are no several steps before you get to see the doctor. You're actually greeted by the doctor and treated by the doctor and get to talk to the doctor the entire time you're here. There is no surprise call, so you don't receive any type of bill in the mail after you leave. You will know exactly how much your visit will cost, really before you get here, because it's going to be included in your membership fee. You will know if there are any medications being dispensed, how much that's likely to cost. Any testing, you would know how much that's likely to cost. And when you leave, you won't receive any surprise bill in the mail from anybody telling you now you owe this amount of money from a visit that you may have gone to several months prior. So that's the overview of direct primary care. Now, so here's a list of some of the typical benefits that you'll find in a direct primary care office. So unlimited office visits are usually included in that monthly membership fee without any additional copay charges onto that. And so what that looks like is sort of like having your gym membership or having a Netflix account. So you pay that same membership fee every month, regardless of how many times you may come into the office. So one particular month, you may need to come several times, 2 or 3 times, depending on what's going on in your situation. Then the following month, you may not need to come at all, but you would have paid that same membership fee regardless of the number of times that you may need to see me. Appointments are available on the same day or next day for urgent needs. So if you are a member of this practice and you become ill, you're able to give me a call, and I'm usually able to get you in either that same day that you call or the very next morning, so that you don't have to wait several weeks to have an appointment. Extended appointment times. So like I talked about, in a traditional family physician office, the appointment lengths are about 15 minutes long. However, at Essence of Health Wellness Clinic, my appointment time slots are 30 to 60 minutes in length. So what that does is allow me the opportunity to get to know you as the patient a lot better. We actually get to sit down. You don't feel rushed through the visit. You get to ask all of the questions that you may have come with, and I really get to educate you properly, and I don't have to just quickly rush you through to get to the next person, because I've allotted a significant amount of time for you as the patient. Telemedicine at no additional charge. So one of the other facets of direct primary care is that you have direct access to me as your physician, and that includes after hours access. So my patients are able to communicate with me via text messaging, via the phone like usual, via email, and then I also offer video conference visits. And so what that looks like, if somebody becomes ill in the after hours or on a weekend and it's not something that they actually need to come into the office for, I'm still able to meet with them on video and do it just like a telemedicine visit like you may get from Teladoc or HealthTap or one of those places, but it's included in your membership costs here at Essence of Health. A couple of bonus benefits that not all of your direct primary care practices may have, but these things I do have here at Essence of Health Wellness Clinic is in-house medication dispensing. So I do have a small collection of medications that are available to you as the patient. And these medications are available at significant discounted rates. These are generic medications, and they're usually about 50 to 80% off from the published prices at local pharmacies. And so there are a lot of the medications that most of you out there may already be on. So your high blood pressure medicines, your diabetes pills, your antibiotics, steroids. So it's a number of different medications that are significantly cheaper. And even my insured patients, some of them still have significant copays that they have to pay for their medications, and so they are also able to take advantage of these discounted prices on these generic medications. Lab discounts through negotiated rates. And so I am contracted with a couple of our local laboratories, and so that gives you a significant discount off of those lab costs. I don't know how many of you all have had testing done at your doctor's office, and then you receive a bill in the mail for that testing a couple of months later. So even though your insurance may have paid a portion of it, you're still responsible for another portion. And a lot of times you really don't know what that portion that you're going to be responsible for is going to be until you receive that bill. However, the way it's worked with labs, when insurance is not a factor, and it's more of a direct relationship with the lab company and with the physician, then they're able to lower those rates a lot more. And so with that in mind, we're able to get deeply discounted rates on lab tests. Some of your traditional testing, for instance, even a typical wellness panel, which would include things like your blood count, your kidney function testing, your liver function testing, your blood sugar, your cholesterol test, thyroid test, that whole panel of tests is going to roughly cost about $20 to $25 here at Essence of Health. However, in the insurance world, you may get a bill for about $100 or more, typically on those labs. Now, so I told you that I would compare direct primary care to concierge care and tell you a couple of the differences in that. So for instance, with direct primary care, people pay a monthly membership fee. If you look at the national averages of those membership fees, it's roughly about $75 to $90 per month per patient. Here at Essence of Health Wellness Clinic, my fees currently are $20 for children, and then for adults, the prices vary by age, and they range anywhere from $70 to $90 per month. And in a concierge type of practice, those practices, they will bill your insurance. They usually take a variety of insurances, but they do bill the insurance, and then they will charge you a monthly fee on top of that, and that monthly fee on top of that then gives you direct access to that physician in a concierge practice. The nationally published concierge membership fees usually average about $100 to $200 a month. The reason a direct primary care practice is able to charge less is because they don't do any insurance, and so that actually creates less overhead in direct primary care. And so what happens is the direct primary care practice then give those savings to you as the patient, so they don't have to charge you as much because they don't require as much in their office, but since they aren't billing your insurance company. Something that both types of healthcare do, both in direct primary care and in concierge medicine, is we will put a cap on the number of patients a physician will care for. In most direct primary care practices, the physician will limit their number of patients to about 500 to 700 patients. And for comparison, in a traditional family practice office, a physician may be responsible for about 2,000 to 3,000 patients. So in a direct primary care office, their physician is going to care for a lot less patients, and that's because they want to continue to give you that direct type of relationship. They want to continue to give you that personalized type of care. So therefore, we tend to take on less patients to be able to afford all of our patients the opportunity to receive that same level of care. And then both direct primary care practices and concierge practices give you direct access to the physician. As I said, as a member here at Essence of Health Wellness Clinic, you will get direct access via text messaging, phone calls, email, video conference. So you'll have a variety of methods to be able to contact me as your physician. Now, so I'm going to show you one way how Essence of Health Wellness Clinic and a direct primary care clinic can save you money. So this is just a type of visit. So say it was the weekend, for example, and you developed a sore throat and a fever. You aren't exactly sure what's going on, so you want to see a physician. So if you are a member of Essence of Health Wellness Clinic, you're able to contact me directly, and I'm able to see you. If not, and you are in a traditional model of care, you may have to go to a local urgent care. Now, I'm going to break down a couple of costs for you. So first off, we're going to think about the cost of the visit to see the doctor itself. So for a member at Essence of Health Wellness Clinic, that cost would be zero charge. And it's not going to be zero, it's going to be zero charge because there are no additional copays per visit when you're a member here. You just pay your monthly fee, and then when you need to be seen, you're able to be seen without any charge. At a local urgent care, that cost of the visit, it's going to be roughly $100 to $150. I actually called an urgent care just this morning and was quoted $120 for an office visit there. True, if you have insurance, you may be able to get away with a little bit less, but even under most insurance policies, there's going to be a fee for using an urgent care facility. Now, you have a sore throat and a fever, so you may need some testing while you're at the doctor's office. If you are a member of Essence of Health Wellness Clinic, a strep test would be free of charge. A test for mononucleosis would be $3. And if I had to screen you for the flu, it would be $12. Now, this is comparison to a local urgent care here in Chattanooga. If you needed a strep test, the cost would be $23. A mononucleosis test would be $15, and a flu test would be $50. Now, let's say you had all of this testing done and it showed that you had the flu. Because Essence of Health Wellness Clinic does dispense generic medications, you could pick up your prescription for Tamiflu right here in the office, and it would cost you $9.75, so less than $10. However, if you were at that same local urgent care, they would need to call your prescription in to a local pharmacy, where the currently published rate of Tamiflu without any insurance at all is $43.25. Now, your insurance, once again, may cover some of that, but even under most insurance plans, you're probably going to pay $20 or a little bit less. So as you can see, just in comparison to being a member here at Essence of Health Wellness Clinic or a direct primary care clinic versus going to a urgent care facility, you're going to have significant savings, which is going to be even more than what you would have paid for that month of your membership fee. Would be what you would save versus spending all of that money just on one visit at an urgent care, and that's not counting if you needed any additional type of follow-up after your illness. Now, direct primary care is also very beneficial for employers and those owners of small businesses. Now, some of the benefits that are provided to employers are that they are able to give their employees some sort of health plan without the high cost of insurance. A lot of small business owners would like to keep their employees healthy because, as we know, healthy employees have greater productivity and produce more for the company. However, a lot of these business owners run into the high cost that they may have to pay for insurance for all of their employees, and sometimes it's prohibitively affordable to those owners to do so. So a practice like a direct primary care clinic can be a wonderful alternative to be able to still provide your employees with health care. Another benefit for employers are that you're able to attract more dedicated employees by offering some sort of health care. Small business owners are up against the larger corporations who are able to afford those group insurances for their employees. And so that can be difficult for some small business owners to be able to compete to get those wonderful, well-educated, well-trained employees because they don't offer any healthcare benefits. So this gives you the opportunity to offer that healthcare benefit. Here at Essence of Health Wellness Clinic, there is a special rate available for employers who sign up 3 employees or more. And so those employees would be able to take take advantage of the same benefits as a regular member of Essence of Health Wellness Clinic. They would still get those unlimited those unlimited visits. They would still get those extended appointment times. They would still get access to same day or next day availability for urgent needs. They would still get access to those deeply discounted generic medications that are about 50 to 80% off published rates. They would still get discounts on their lab testing. And so it can be a significant benefit to employers. And so that's what I have. In a nutshell, that is direct primary care. Direct primary care can benefit you and your family. I am family medicine trained. I have been practicing for almost 10 years, and I am trained to see children from newborns and infants all the way up to adults and elderly population and everything in between. I am fellowship trained in obesity medicine, and so what that means is I'm trained to be able to help those individuals who may be struggling with morbid obesity and the chronic diseases that may come with that. I'm trained to help you to lose weight, to help you with medication management if needed, to help with dietary coaching, exercise coaching, mindfulness, and ways to help you lose weight. I'm also certified in plant-based nutrition, and so I incorporate a lot of what I do, a lot of the nutrition coaching that I do. I incorporate plant-based nutrition and teaching people how to use plants and plant-based diets to help prevent and to help manage chronic diseases. Thank you all for watching. Essence of Health Wellness Clinic is located at 752 East Martin Luther King Boulevard. That's right here in downtown Chattanooga. The phone number is 423-225-2245. You can learn more at www.essenceofhealthwellnessclinic.com. You are on the Facebook page for Essence of Health Wellness Clinic. There's also an Instagram page, also under Essence of Health Wellness Clinic, and a YouTube channel at Essence of Health Wellness Clinic. Feel free to ask any questions. I'll hang out for a little longer. Thank you for watching.